Hi there, it's David Denis from naturalhappiness.ca. I'm wanting to talk today about what I think are the top 3 questions to ask your psychotherapist when trying to find out whether or not the psychotherapist you're meeting with is a good fit for you. If you're finding this video, you probably are in agreement that it's a good idea to make sure that you've found somebody that you can work with. And there's a couple of different ways of thinking about how to find somebody who's a good fit for psychotherapy. I've seen in my practice many people who've had past experiences of psychotherapy that haven't worked out and have had good experiences subsequently with myself or with other therapists. I've also met with lots of people who very early on we can agree together that I'm probably not the best fit for them as a psychotherapist, and so then they can not waste their time and move on and find somebody else who might be a better fit. So here's what I think are the top 3 things to think about. Number 1 is to consider the training of the person that you're working with, to make sure that they are a psychotherapist, a registered psychotherapist. And here in Ontario, there is now a college that regulates the act of psychotherapy, and you want to make sure that the person you're working with is actually a psychotherapist, which is now a regulated kind of therapy here in Ontario. You want to know whether they're a psychologist or a naturopathic doctor with additional training, or whether they're a social worker or a psychiatrist. And you also want to know, in addition to their certification and their clinical background, what specifically are they trained in? And what kind of modalities do they operate with? There's many ways of doing psychotherapy. There's things like cognitive behavioral therapy, dynamic psychotherapy, interpersonal therapy, amongst many, many more. And so it's good for you, if you are looking for somebody, to have some sense of what kind of modality you might be interested in. And if you know that modality to some degree, then you want to make sure that your therapist has done some significant training in that modality. I've seen many, many people who've been to therapists, and the therapist said, yeah, I'm trained in CBT, and the patient's looking for CBT, cognitive behavioral therapy. And then with a little bit of exploration, I'm finding out that they didn't really do CBT. Cognitive behavioral therapy really isn't proper cognitive behavioral therapy if you're not being given any homework to do between sessions, and you're not really doing thought records. And so there's some specific things to know about the modality that you're interested in, and make sure that your therapist, if you're looking for a specific modality, is actually properly trained in that modality. If you're not sure what modality would be best suited for you, then that's okay. It's still worthwhile asking your therapist that you're meeting with what modalities they're trained in and they might think are helpful for you. Now, the second thing is that it's really helpful to know whether or not your therapist that you're considering has experience with your particular concern. If you're suffering from depression or low mood, you want to work with somebody who's seen many, many people with a similar kind of condition or difficulty. So they've got some experience and some know-how around that particular presentation that you're bringing, so that hopefully they can be more effective at helping you. If you're not really sure what it is that you're dealing with, you just know that your mental health's not doing all that well, and you need to see somebody, then just through a little bit of exploration, you can still ask the question, have you seen somebody like me with this kind of problem? And also asking, how do you plan on helping me with this? What's your general approach? And just see if what the therapist says resonates with you and makes sense to you. So really knowing the condition or the kind of problem that you're dealing with, knowing that the therapist has experience with that, is probably the second thing that I would ask. The last thing is to really consider the personal fit. Not every therapist is going to be a good fit for every patient, every person looking for help. And so there's a couple of things to consider here around personal fit. First one is just a sense of comfort. Is there a sense of ease in being there? And this can be a little tricky because you might be feeling really uneasy about talking about these kinds of problems that you're bringing. But you want to feel like you've got some level of comfort in just being in the room with that person. You also want to see how it is that they listen. and whether they're listening to you and really understanding you, which are two different things. So what this can look like is, kind of the basics of therapy are one, to be able to really listen, to not jump in and interrupt or to take up too much of the airtime, speaking too much, to be quiet and to really listen. And then you'll understand whether they understand you if they're able to reflect back to you a real clear understanding of what it is that you're communicating. And a good therapist will not just parrot back word for word what you're saying, but actually capture the meaning and the essence of what it is that you're trying to communicate. Sometimes when we're really struggling, we actually have a hard time communicating in a clear, concise way what it is that's going on for us. But a really skilled therapist will be able to kind of listen to you and hear it and read between the lines a little bit and be able to help you and together come to some kind of understanding. So make sure the therapist has some good ability to understand you and your experience and the ways in which that you're struggling or suffering. And the last thing about personal fit that I think is really important is that the therapist be really open to feedback. Whether or not the therapist is going through some kind of really structured therapy like cognitive behavioral therapy, or doing a more kind of loose, open-ended therapy like psychodynamic therapy, it's really, really important to be able to speak to your therapist about the things that aren't going well, or things that the therapist is doing that maybe rub you the wrong way a little bit. Or to just even be able to step back and talk a little bit about your fit with him or her. And being able to do this becomes a really powerful aspect of psychotherapy. And you'll know right away as you test it out whether or not how open your therapist is to doing this. Maybe there's something right in that first visit that kind of bugs you a little bit. You can test this out by just saying, this is interesting. When I was sat down and when we met, the way that you asked that first question, I felt a little bit off. And just see how they respond. And they might say, they might come back with a rationalization of what they did and why they did it right away, which would be a kind of a bit of a sign of defensiveness. And that would, for me personally, I would say, okay, well, maybe they're not so open. Or they might respond by really getting a bit curious about your experience of the difficult moment, asking you a bit more questions so that they can better understand what happened. And sometimes even being able to apologize. This is actually a really helpful thing for a therapist to be able to do when they put a foot wrong, while also understanding how that impacts you and your own personal experience and how it might relate to your own goals in therapy. So this kind of ability to talk about the relationship and the therapy and to be open to feedback is something that I think is really important when trying to find somebody who's a good fit for you. So to review, the top 3 things that I think are important is to consider the person's training, whether they're certified to practice psychotherapy and the specific training that they've received, whether they have experience working with the kind of condition or a way of suffering that you're bringing into the psychotherapy, and then lastly, the personal fit. Are you comfortable with them? Are they open to feedback? Are you able to talk about difficult things that are coming up in the relationship with the therapist? And sometimes I would say I'd encourage everybody to be open to having to speak to a couple of different people before you find somebody who's a really good fit. Sometimes it takes 3 or 4 interviews with people to really get somebody who clicks with you. So if you like this video, feel free to like it here on the YouTube channel and subscribe if you're interested in seeing more videos. And otherwise, have a very happy day.